Hello, this is Chun Se-young of the Digital Hub Dental Clinic. Today I'm going to talk about the category of digital dentistry. So we will look at what are the areas you could use digital dentistry. When you say digital dentistry, it's about CAD/CAM, and CAD/CAM, of course, means all ceramics. So what can you do with the ceramics? You could do inlay only, aesthetic laminates, veneers, and also crowns, bridges, and porcelain fused veneers, and artificial dentures, as well brackets for orthodontic treatment. These are the areas where all ceramics are used, so you can say we use in very diverse areas. So classification-wise, you can do in three ways in terms of application, fabrication method, and whether it's crystallization or not. So in terms of application, as I told you before, metal or gold crown aesthetically, you do veneering, so you could use in metal ceramics, or you could also have all ceramics for crown, bridges, and veneers. In terms of fabrication, lucite, alumina, this type of materials can be sintered, and you baked for a long time at high temperature, so you can create new properties, or you could do wax up and cast. And zirconia or CAD block that's already been made using CAD/CAM, you can mill and cut it yourself. And in terms of crystalline phase, whether that exists or not, you could use in a glassy phase or some materials. You can also go to or beyond crystalline phase. So this is how to change the characteristics of ceramics. Now, all ceramics could also be divided by generations. And let's see what materials are used. In the first generation, glass ceramic, lucite reinforced glass ceramic, or you could also have a Mach 2. So aesthetically, they are very good. So on the anterior side or aesthetic dentistry, this was very popular. It's been a while since it was first developed, and it's also still very popular, very nice material. But flexural strength is about 150 megapascal, so it's a bit on the low side. So on the anterior side, or where the gluteal is not too strong, you use it in that area, and because of that, low strength, you need to have occlusal reduction in the margin side about 1 millimeters or 2 millimeters. And but the another strength is the cementation of all ceramics. It can you can cement with resin. So in the clinical setting, you can fully leverage that strength to create a very nice prosthetics. In the second generation reinforced ceramics, you probably know EMAX very well. And in glass ceramic, lithium disilicate filler is added to improve the strength compared to the first generation, while it's also very nice aesthetically. So on the aesthetic dentistry and upper anterior, this is widely used. Before sintering, as you can see, it exists as a green material, and that's how it's delivered to us. And it has about the flexural strength of 130. So in terms of fabrication, it's very flexible because not that strong. And after recrystallization, the strength increases a lot by 306 to 360. So strength has been reinforced. So for laminate and for crowns, it's a very popular material. Of course, there is a contraction by 0.2%, but that is not big number, so you don't have to worry a lot about contraction. Because it has good strength, the teeth cutting amount is smaller than first generation, and the strength can still be maintained. So compared to first generation old ceramics, it's less burdensome to use and very safe to use. Of course, aesthetically, it's good, but the strength is also good, and that's why it's so popular. The third generation hybrid ceramic, and resin has been added to the ceramic, so it's stronger than resin. And compared to first generation and second generation old ceramics, as this has the properties of resin, it has elasticity, so it's very flexible, and it has less brittleness. So these are the strengths of the hybrid ceramic. Lava Ultimate or Bitas Enamic, this type of materials are third generation. Of course, there's not yet long-term data, but it's widely used in clinically, so in aesthetically, strength-wise. Of course, there's a bit of shortage, but it's overall not a problem. So then we come to the fourth generation, which we now use a lot. This is full contour zirconia. These days, color has also been improved, so you can even use on the anterior side. And this zirconia requires about 7 to 8 hours or up to 20 hours of sintering at 1500 degrees. And with crystallization strength and color improved, and the strength is about 900 to 1200 megapascal. So even in the posterior side in the bridge, it can stay strong. Except compared to resin or ceramics, in terms of cementation, it's not Raman cemented. So compared to resin cement, now I think GI cement is mostly used. But I think overall clinically there's not much of a problem. Aesthetically, compared to the first and second generation, it was a bit lacking. It's strong, but in the anterior or aesthetic area, it only had a limited use. But in the last 1 or 2 years, very translucent blocks are available, and multi-layered gradation blocks are also available. So even all ceramic on the anterior side, zirconia has become a very attractive alternative and example. So first, let's look at some actual cases. This is on the upper side, number 11. All ceramic crown was fractured and came to the hospital. So after removing the fractured side, with the CAD-CAM, we designed and milled and then did restoration. In the past, Emax was used, so only one tooth doing the treatment was okay, and the result was satisfactory. In terms of aesthetics on the anterior side, Emax or first generations all ceramic or second generation all ceramics, I think aesthetically is the best. In terms of the satisfaction of the patients, this is also the highest. Next case. We also call this a 1/4 crown or ceramics. So on the upper side, maxillar side, number 11, 12, 13, and 21, 4 teeth were laminated, and gingivectomy was used to improve aesthetically, and using CAD-CAM design was done, and with milling, the laminate has been prepared and delivered. Actually, the anterior side all all ceramic is aesthetic dentistry, so it requires skillful technicians, which means it required a lot of experience and skills. But thanks to CAD/CAM in general, dental clinics very satisfactory. This type of result can now be obtained. So if you become used to using the digital dentistry, I believe in your clinic this level of high quality anterior aesthetic prosthesis treatment would also be possible. Now, in the past lecture, I talked about one-day inlay, and in this lecture, I will also briefly mention about inlay. As you can see, with the CAD, inlay was designed, and as I explained, third generation hybrid ceramics was used for milling and then delivered to the patient. So number 37, it fits well, and as an inlay, it's something that I always recommend to be the first treatment to use with the CAD/CAM if you just starting off with the CAD/CAM, because it's very easy to do compared to other things. So please, I recommend you to start with digital dentistry with inlay. So materials is 3M's Lava Ultimate you could use, or there's also Magic Duro from Korea. So strength-wise, yes, I was a bit concerned in the beginning. I was not as strong as others. So in terms of long-term stability, there could be some potential of fracture, but in actual usage, I find that it actually is very flexible, resulting in less fracture. And if you do very thorough operations, and if you have the fracture would not be an issue, and you could even finish it all in one day. So this is something submerged approach that I use. So after design inlay and you mill the inlay material, if it's crowned, then using supporter, you can fix it in place, but inlays is small and the contact and occlusal surface, if you use the type of connector, then in adapting to the patient, it could require a lot more time and it could actually distort the occlusion. So first I cut the occlusal surface, the upper side, and then I use the stone for submerging it and cut the other side. So two-step is what I do in milling, and with that support, without support or screw, this inlay can be made and sent to the patient. So this is the preferred way for me in milling. Another thing is a lot 3D printer has become very popular, so we also use that a lot in connection with the inlay. And as you can see, we print the inlay and set it to the patients. So in the digital dentistry, implant practice is also what you can do with digital dentistry. So custom abutment, temporary crown, or even the final zirconia crown, all can be finished with digital dentistry. So general prosthesis or inlay practice or crown bridge and up to implant practice. In other words, a lot of things we do at clinic has now become available with digital dentistry. This means very soon full denture and other works could also be all digital based. And I think that future will come very soon. So I hope that you can get experience a lot in digital dentistry very soon, so that you can maybe adjust yourself to the changing future. So, in terms of the designed abutment and temporary crown, as you can see here, with the milling and printer, it's created, and you can create the custom abutment. And before surgery, you prepare this and go to the surgery and set it to the patient. And the precision level in the one-step approach in terms of margin and contour, it's available up to this level. So it's very satisfactory in terms of fit and precision level. It's really good. So we set it up to the patient, and it's before we do occlusal adjustment and margin fit, the quality, and occlusion. It's all good. So with the digital dentistry, this type of quality is now available even today. The TMJ joint patient, or if you have a joint problem, or for that type of patient, CR splint or different types of splint with the CAD/CAM design and 3D printer, we do this at the clinic, and we create CR splints for this patient, and this is also currently being done. And the most widely used a case, temporary crown and bridge or temporary denture, actually prosthesis or implant surgery, we use them a lot. So the share of temporary in clinically, it's very high, and with the CAD/CAM, Meland bridge can be created like this as a temporary, and ready-made Meland bridge and general temporary bridge is delivered to the patient. For the long bridge, if you create beforehand, it can reduce chair time for a patient. And with the CAD/CAM, the healing mechanism and gum shape can be considered in your design. So making by hand, or where your staff does it, it's compared to that, temporary with this is higher quality. So full denture for edentulous cases, we create a lot of individual trays. So we send it to the lab and get it back. But if you use a CAD/CAM, then you can just print it out at your clinic, meaning the time interval will be short for a patient, and material cost and the other lab cost could also be saved. So this is another solution we use at my clinic also. Now in implant surgery, if you say digital implant guide surgery, Osstem's one guide is you use a lot. So using 3D printer in your clinic, doing a guided printing is another area that's very popular in digital dentistry. Now, in digital dentistry, especially about implants, with the digital dentistry lectures that I've done beforehand, I've talked a lot in about 8 lectures. So I think now I will talk about zirconia, so more specific information about zirconia. First, zirconia, compare from the past, it has advanced a lot. In the past, full zirconia white block, it has no color, was first developed, and that block was mostly used as a core. So porcelain fused metal crown or PFG, that type of crowns, in the inner side it has metal, so it didn't have a very good colors. It shined through in the gum also, and then porcelain was used as a veneer. So it's still used a lot too, but now better property zirconias are also developed. So those disadvantages do not exist anymore. But then we had color block, A1, A2, A3, B2, B2, B3, indicating the colors of the teeth, and zirconia block. We also had colors with color block, so it became easier to choose intuitive colors for the teeth. But this block for coloring and staining, it's a bit complicated, and compared to all ceramics, aesthetically, it has some problems. So it has some limitations. So it was mostly used on the posterior side. And for full contour zirconia, is what's now developed. I think this is still the most popular block. And then aesthetically upgraded zirconia block was continuously invented, and now, as all ceramic, it has even trans effect. That type block has been invented. Now trans block, that is called. So on the aesthetic area, interior side, this block can also be used with trans block. So coloring and staining are still needed. And if you do that, aesthetically, you can create much better results. Now, it's closer to your natural teeth. And having that properties, you now have gradation block from the subtica to incisor. There's a gradation. So it's very close to your natural teeth, and if needed, staining and coloring can be done. But I think when I use that for this type of block, you don't need much of staining or coloring. It has, a very close aesthetics as all ceramics. So first, white block. As you can see here, the core is the block, and it's falsely laminated around it. And this is color block. There are different shades of color blocks. So you could have more intuitively match the colors. And then you have, as the next development, this type of zirconia. It's very trans. So aesthetically, it can also be used on the anterior side. It's also strong, and it has aesthetically good as all ceramics. So zirconia, now thanks to this block, it's used more in more wider area. So this is a color block case. First, using CAD, number 11 and 21 were designed on the upper side. This is preparation and setting. Trans block using in the anterior side, me or the patient, there was not much of a problem, and even it has a good aesthetic pleasing results. So first generation, second generation, all ceramic usage is now not as frequently used as before. This is gradation block. As you can see here, the body layer and enamel layer, between there is a gradation block, so it looks very natural. So it's very as if it's your natural teeth, and light scattering is also good, and the strength is also good. Now, full contour zirconia, as that trans block was used for this restoration job, but if you don't look very close, you cannot tell what was used. Now, number 11 and number 23 were colored and set it to the patient, and the results, personally, I'm very satisfied. And using CAD-CAM very easily, we can delivered to the patient. Next, on the anterior implant side, metal or titanium abutment is used. Then colors, aesthetically, it's not that pleasing. So the abutment, now using zirconia, a link system or ready-made abutment is used. But custom abutment here is created with zirconia, and to make it most aesthetically, that approach was used, and it was quite good. So in CAD/CAM, milling and doing that, as I explained in before lectures, I emphasized that milling you design with the CAD, and the CAD machine, the 3D to have 3D shapes and cutting, the milling controlled, and the path is designed with the CAM software. And Hyperdent and Mailbox are the CAM software mostly used for that type of milling planning. And 3D printer is very popular. And you have different layers and stack it up in layers. That's the concept of 3D printing. So how can you communicate that layers to the 3D printer? Like what is the thickness of the layers and how many layers you're going to have? That can be done with the CAM software. We also call this as a slicing software, and this is a software that would also help your work. And how the zirconia is made, let's explain with the color blocks. Like this, using CAD/CAM zirconia teeth, a bridge was made, colored and then sintered, and the final prosthesis will be made. Now on the left top, you have the zirconia block. In the milling machine, if the teeth is cut, this is how it becomes available, and dead crowns are divided, and you can see here it's colored to look too close to your teeth, and then it's dried, and 7 to 8 or 10 to 12 hours colored zirconia blocks needs to be baked at about 1500 degrees of temperature. Then it's recrystallized, and then you have good size and very natural color color looking teeth. And then stained, or if not stained, it's glazed. And then another step of glazing is sintering, and the final prosthesis is made. And shade 3.5, and you compare the shades zirconia aesthetically, you can see it's very good. Now I talked about the zirconia crown. Now in the digital dentistry category, you not only do prosthesis but also orthodontic works. So let me explain about orthodontics with the digital approach. So mostly here it's digital orthodontics is possible mostly with the setup. And teeth analysis using calipers or like the tape measuring, you had to use those tools, but now it can be done automatically. So you can do indirect bonding like this. So when you do digital setup, the bracket location automatically set to fit the ideal arch shape, and then through scanning and Zik, you can create like this type of indirect bonding. And setup, if you use clear aligner, this is also good. So you scan digitally, do analysis, and you plan, and then you produce different teeth setup models, and based on the printed model, you create clear aligner to do orthodontic treatment with it. So this is also an area where digital dentistry is used, and you can do this type of indirect bonding, and the bracket position is set. Then through this tray, through the indirect bonding, you can deliver it to the patient. So even the type of bonding system very easily, and you can do patient and brackets can be also created in multiples and used to the patient. Now, I talked about digital dentistry today, and let's see some of the questions. The first question is, using digital dentistry, I'm doing this for the first time, so how should I get started? Now, digital dentistry, now you can apply in many different areas, and to do that, you need oral scanner, milling machine, 3D printers, all needs to be set up. Of course, you also need different softwares, which is not easy. What I always emphasize, if you're a beginner, don't try to do a lot of things at the same time. Just with the oral scanner, one guide related scanning, instead of rubber impression, you use that with scanner first, and in prosthesis work, what is easy to use and still promise high quality will be inlay. And with the 3D printer, creating guides or temporary crown could be done. So with that, you can step by step expand usage of digital in your clinic. So, and then the next step could be using Zirconia a crown with the digital dentistry. So don't rush into things, gradually, step by step. If you set up like that digital dentistry in your clinic, then without much stress or problems, you will see your clinic transforming to digital dentistry. Second question, is zirconia aesthetically good to be used in the anterior? Could you compare that to all ceramic? Now, I talked about zirconia, and I said that trans block or gradation block, with those being available in the maxilla anterior side, now zirconia can be also used. As of now, using those blocks compared to all ceramics, it's not that far, behind. That these blocks are also very good, and all ceramic being too translucent, it could be too transparent. So maybe in that case, using zirconia block might be better. And strength-wise, it's also very attractive. And compared to oil ceramics, it's in terms of trans or translucency or parency, it's a bit in lower in terms of property or characters, but it's not a big difference. So at my clinic, even on the anterior side, rather than all ceramics, I use gradation or trans zirconia and do aesthetic prosthesis for the upper anterior also. So there's not much of difference between all ceramics and zirconia now. So being interested in moving toward more zirconia would be okay. I hope that my lecture has been of help to you. The next lecture will be my last lecture in digital dentistry. I look forward to your continuing support and interest, and I'll see you at the next lecture. Thank you very much.
감사합니다.